Okay, we're good. So next, I think we need to discuss more about the phases and the past phase that the past two phases with CHOP. I think we were finding some discrepancies maybe in the PAFs as to what the phase number 8 and number 9 were, and if we want to continue maintaining those phases, or if there was, like you mentioned earlier, somewhere where we could grow or add or change anything.
Yeah, this I would like to mention, I would like to classify. So we can keep going on the two phases, phase 8 and 9, but we add more other activities or other objectives. We review or revise, the PS. So if we see some object is not really reliable in the current situations, maybe we change some of our visions, some of our directions. So each evaluate for evaluation the communities, because even the community here is changing a lot. The people, because of this, the legacies of the COVID-19, the impact of COVID-19, the children, especially the women, they have a lot of difficulties because of they face all the transportations. They cannot go to another place for their head treatments. For the especially either pregnancy women, they cannot go to the clinic and hospital for the delivery baby. Even the woman, if even they need the family plannings and the other thing, they don't really have access this kind of facilities or equipments. Another thing for the children, because of the shortage of the job, their parents don't have a job, so the parent cannot provide the sufficient food. So it can cause the nutrition problems, malnutrition or nutrition problems. Malnutrition problem in the migrant areas. Another problem is the water and sanitation. So they don't have the regular income, so they cannot afford to buy the drinking waters. So they have to use the waters for the streams for the waters, which came from the agricultural plantations. Agriculture plantation is mostly they use the chemicals, the others chemicals usings. So it can cause so many problems. The skin infections, others tuberculosis, or other diseases in the migrant areas. Because according to my research, I've found that 75% the people they are affected by the chemical uses. This is another problem in this area. Because I have found that it's mostly the people they are using the chemical every single day. Even if the pesticide, we call it pesticides, because they have to use pesticide in order to make grow the plants growing faster, and also they don't really have the sufficient knowledge how to prevent themselves, how to use the tool properly. So they got the injuries, long-term injuries, and also we can categorize long-term and short-term. Short-term is mostly they got injury, their hands, and also their legs, and also their brains, their disease or other things. The long-term they got the diseases, another disease like cancer, so other cancers.
So ATL right now, the funding that we send every year for CHOP, it goes towards the workshops, the peer educator salaries, the contraceptives that are distributed to the participants. But how can we change this to address the issues that you're talking about? Or is there anything that SAW would like to add to address these issues that we can support?
Yeah. As for me, for honestly, far out all the budgets at grant, I would like to go in the activities. But on the other hand, we also have some our peer educators. They are the pastors who are working with the community very closely. So we also would like to provide some, because they also have their family in back. So we for as usual, we provide them some. So this way is I would like to maintain for the two. Now we cannot see the salary. We just use it the stepping for our peer educators. The at the same time, we as long as we have our workshops and trainings, so we provide them foods. And also sometimes we also provide them some of the transportations because they have to cancel for very fast wins. This one. Another one is for our facilities, our equipment, which is very necessary for our workshops and training. Another one's for our right now we are going to train our students to be facilitators. We have 3 or 4 5 students. They are very we will train them to be in this positions, either facilitator positions. So because they have finished their school, right now they cannot go back in Burma. So they are in Burma. Either the school at university or college are stay at the very restricted. It's not allowed to open yet, so they have to stay here. We can say it can be longer. 1 year, can be 2 years. So as long as they are staying here, we also would like to give them some stipend, not salary, and they can use their own, right? This. For other for me, so for UAs, we are not going to take any there. So we are staying in this position. We will use for our news the trainers. And also our mostly the 85% of the 19 we use for our activities. For the 10% we use for our peer educator stipends and our new facilitators stipends.
So now that we are talking about the budget for CHOP a little more, I just wanted to be transparent with you that we are not sure if we will be able to raise $10,000 again this year, just because we had to cancel our benefit dinner in the spring already. We're not allowed to have any in-person fundraising activities this year, but we will be having something virtual. So after speaking with Noah, he's our donor relations and campaigns director this year, and sitting down and looking at the changes, we think we can project about $6,000 to $8,000 to send next year for the program. So obviously we're going to always try to raise the $10,000, but I think it's more certain that we will raise about $6,000 to $8,000.
Yeah, it's a fine because the every organizations, even the every organization, the big organization, huge organization, they have this kind of situations. But we have to accept these conditions, these circumstances. Yeah.
And I also wanted to let you know we for this year, the money that we'll be sending, we have 3,100 that we can send now, but we are waiting to receive a deposit from our last benefit dinner that we made so that we can send $4,700. So I just want to know, would it be useful if we send the first part of that money as soon as possible and then send the deposit once we receive it? Or would you like us to send it all together?
I think you can set it together if you prefer, because if I got this all others first, I can I can place my work plans. I can read the proposals. I will adjust the menu plans. How much I can organize the workshops and trainings. Based on we have our resources, no? Based on we have resources, I have to read the budget plans. I have to rearrange new budget plans and our work plans. I have to adjust. So based on the resources, how many percent should be goes in the activities? How many percent should we go to our beneficiaries, our helper, and our organizations? Or I can adjust.
Okay, so then we can follow up about that so that we can make those adjustments for this year.
Yeah.
But like I said, for next year, it'll look like about $6,000 to $8,000 that we can support.
So you mentioned me, right? The first you are going to transfer is for the NIST project, right? No, for the previous projects.
So this past year, the money that we raised, we have not yet sent it. So that we can send now for this past year. But what we're discussing about the PAF is that we can project about $6,000 to $8,000 that we can send next year.
Okay, I got it. Okay.
I'm curious, what sorts of changes will have to be made in order to accommodate this budget? Would the number of workshops have to decrease, or the number of workshop attendees?
I think for the workshops, are we not going to decrease anymore? I will keep the elderly trends. The elderly trends. There is only the workshops and trainings. We have another group discussions, and also the others, the facility teams and family planning materials to contributions activity as well. I think I can adjust the budgets. I will not increase the workshop anymore. Because in the community, our entire communities, the community is getting grown. Because of the new community is appears. So we need, as for means, we have to expand our activities. Instead of the reducing the activities. But based on our resources, our keeps our workshops, our trainings, like the previous we plans. Yeah.
Okay, so so for this year, things obviously will be looking different because of COVID and because of the resources and the money that we can send. So you know, the PAF for the PAF for this year has included ideas for what phase 9 will look like. So you mentioned maybe expanding in some areas.
Yeah.
So was there anything like specific that we should include in the PAF that we want to see next year?
Because our program is we are running under the health education program, right? So we for me only wanted to focus on health issues. Health issues can covers a lot of the issues, nutrition or others, communicable disease or non-communicable disease, other seasonal diseases or other female diseases. So for me, I have found the case that I found mostly the problem in our target communities. The reproductive health. If we say reproductive health issues, we can categorize two: adolescent reproductive health and reproductive health. Mostly reproductive health issues in the migrant area is very common, so it's very serious. We can say that because they are very illiterate, so they cannot read, rest, they cannot have access to informations. Is regardless of health informations. So how to maintain, how to prevent the access from the possible dangerous situations. So they also have the even another our the barriers, another obstacles for the females. So they are growing in the communities because their communities is also related to the cultures. So they have found their difficulty there. The early marriage, early marriage. They are only the 14 or the 13s and 14s. So their parents forced them to get married early. So they have faced another problem is abortions. And instead abortions, they use a traditional way. So they have the pastor who are going to have the woman to make the abortions. They use this tool and a safe tool and others and an illegal way. So it can affect to the woman's head. Some of the women they have deaths because of the bleedings, because of the bleedings. Because this another reasons I found this. And like I mentioned another way this chemical using the effect. We can see in the agricultural health issue in the migrant areas. Another way we need awareness. The awareness is advocacy. It's very essential in the communities because they are living in very remote areas. They are very property. So even their work is not really normal. It's not really regular. So they do the information accuracy is very impossible. And so right now the organization is around the mesos other poor area. They don't really organize the meetings to conduct the meeting in the community anymore. They have some of the activity, just observations to conduct the workshop, to conduct the research. Just only this. They don't really have the various as normal like our right now we are doing now. So that's why the community is very is our organizations. They need our organizations to perform this any workshops, any awareness activities, advocacy activity in the community, so that they can accept information from our organizations, so they can have the voice, so they can have raise the questions Yeah.
So then for phase 9, we can expect to maintain workshops, but then increase the awareness and advocacy on the
Yeah.
topics that you mentioned. Okay, perfect. I think that clears up maybe the discrepancies that we had with the phases, but we will continue with phase 9 for next year with those additions. Perfect.
I also would like to do